If a fairly pleasant child becomes consistently sad or frustrated, starts isolating self from the family and friends, and stops engaging with activities previously enjoyed, I recommend an evaluation for depression by a healthcare provider. Depression is a clinical syndrome that affects child's mood, thoughts, and behaviors consistently for minimum 2 weeks. Common mood states in depression are sadness, gloominess, anger, frustration, and severe cases, despair. Common thought patterns experienced by depressed children can include losing hope from the future, believing that nobody can help them, blaming themselves for the things that they are not responsible of, and negative self-dialogue to the point where a child may experience thoughts of not wanting to be alive anymore. Some common behaviors we observe in children and adolescents who are depressed can include eating and sleeping too little or too much, isolating themselves in their room and not leaving. Treatment options vary depending on the severity of depression. In mild depression, talk therapy is the first-line intervention, while in moderate and severe depression, both antidepressant medication and talk therapy is a recommended intervention. And it's important to emphasize that there's no one-size-fits-all approach in the treatment of depression, and a psychiatrist carefully evaluates a child's and family's strengths and limitations and crafts a treatment plan that is tailored towards their needs. In terms of the length of the treatment, there is no significant difference between the adult treatment versus child and adolescent treatment. The talk therapy and medications that have been frequently prescribed for adult population also are prescribed by children and adolescents. And time length wise, the acute treatment tends to last 12 to 16 weeks, and after some response is achieved, then we have maintenance treatment for further improvement in the mood and also prevention of relapses. From a crude statistics standpoint, somewhere in between 30 to 50% of depressed children experience a depressive episode in adulthood. Whether depression will reoccur in adulthood depends on family history, personality traits of a child, and how long child spent depressed. This is why early diagnosis and intervention are crucial aspects of the treatment of depression among children and adolescents.